Let's talk some more about the vaccine hesitancy, and we are joined by Dr. Angelique Coetzee. Angelique is the chairperson at the South Africa Medical Association. Angelique, welcome to Africa Live. Now, Zimbabwe and Nigeria appear determined to take drastic measures to tackle vaccine hesitancy. What is your take on this, Doctor?
Good afternoon, and good afternoon to all your viewers out there. Drastic measurements is not going to do the trick going forward. So, it is the best thing would be to get your people on board and make sure that the message that one is carrying out there to the population is around vaccine literacy, so that you speak to the people around their age groups. Because the same message for 18-year-olds would not be the same for a 60-year-old. So you need to speak around, your targeted audience regarding age groups. You need to make sure that you have a very good communication policy, and that's extremely important. And then you need to create an enabling environment where the people can go to and get their vaccines. We're always saying the vaccines should come to the people, and the people should not go to the vaccines. You also need to take into consideration how difficult it is for some people to get into a taxi to go to a site that they need for them to get their vaccines. So government should rather, again, as I've said, take a more lenient approach and have incentives. Like if you go for your vaccine, make sure that each and everyone's blood pressure is taken. Make sure that their sugar is just being taken as well. Just do something more that would be more alluring for them to go and wanting to get their vaccine. And be honest about the side effects, and get the people to trust you.
All right, Doctor, the matter is likely to spark debate about the rights of individuals. What other steps can address vaccine hesitancy, perhaps educating and understanding the science?
Yeah, it is extremely important, but that comes back again to communication, and you need, again, to give the message at the right level. So in South Africa, there was a recent direction of the Minister of Labour regarding the COVID-19 vaccines in certain workplaces. And that raised the question whether employees in such places may be compelled to be vaccinated. So if you then start looking at all the different laws, and that's I can speak on behalf of South Africa, then it is, we need to take into consideration that when it is a pandemic, national health of the people comes first. And you have to make sure that you ensure your safety of your own people, because you cannot afford to lose people either doing not at work for sick days or dying from the COVID-19. And our hospitals are overcrowded when we get the waves. And I'm quite sure it will be the same for other countries as well. So you need to give the employers, especially if you are working with public, the ability to decide whether their employees needs to get mandatory vaccination from that company, or whether it is a governmental institution or not. But just to bring out a gross regulation saying you have to, it's going to open you up in any case for fraud. So a lot of people will get counterfeit passport vaccines, and it's going to defy the purpose. You have to get the buy-in of the people.
All right, Dr. Angelique Coetzee, thank you so much for your time and perspective. Much appreciated.